Let us begin with prayer. Sit comfortably. Adopt Namaskara Mudra. Let us bow down to the sage Patanjali, who gave us the knowledge of yoga for purification of the mind, Ayurveda for purification of the body, and Sanskrit grammar for purification of speech. Yogena chittasya padena vacham malam sharirasya cha vaidyakena yoparkarotam pravaram muninam patanjalim pranjaliranatosmi. Dear friends, today we are going to focus our complete discussion on prana. Okay. So this is the shloka from Patanjali that says Udana Jaya Jala Panka Kant Adi Asang Utkrantischa. What does it mean? If the yogi is able to gain mastery over the Udana Prana, then what is the result? The yogi will not go down with gravity, he can go against gravity. If he walks, thorns will not get into his feet because his weight is not going down. If he is on the water, he will not sink because he is going against gravity, and he can levitate the body also. Utkrantischa. Okay. Now, I would like to ask very basic question. तुम इधर आ जाओ यार, तुम्हारा चेहरा नहीं दिखता, सामने आओ, सेंटर में आ जाओ, सबका चेहरा दिखना चाहिए मुझे. ये चेयर को पीछे करो. Okay, so how many types of prana are there? Mukh prana, main pranas. How many are there? 5 pranas are there. What are those 5 pranas? So one is we call as mukha prana. Then the other one we call it as udan, going up. Apana, going down. Samana, which is in the center around the belly. From the belly, that one which goes up to the neck, that is udan, up to the kant. From the belly, that one which goes down up to the anus, that area where it moves, it is known as apana. सबका प्राण का एक मेन फंक्शनिंग प्लेस है. Samana is around the navel region. From the navel to the throat is udan. And then in the facial region is mukha prana. These are how many? Downward from the navel down to the anus, downward movement is apana. And then one is circulating round and round in the body, within and around, it is Vyan. Understand? So, first and foremost, you have to imagine the pranic layer of the body in 3 dimensions. Whenever we see this image, we imagine it is in 2D. इसको 3D में feel करो. 3D में कैसा होगा? Saman will be like a ball, like a sphere rotating around the stomach. बैठ जाओ. कैसे होगा उसका movement? How will be the movement of Saman? It will be a churning movement. You know, our stomach has 3 kind of muscles. Vertical muscle, horizontal muscle, and longitudinal muscles. So it can churn up, sideways, and obliquely also it can twist. All those movements are done by Samana. So Samana is very deeply connected to fire. That is why we call that in the belly lies the digestive fire. Correct? Hmm? So samana is the one which cooks the food. Again, you cook outside. Hmm? Samana cooks the food again. But samana can function properly only when the upward moving prana and the lower moving prana are in balance. Okay? Upward moving pranas are udana and prana, mukha prana. Downward moving is apana. Hmm? When they are balanced, samana cooks the food. Can you tell me any shloka from Bhagavad Gita that tells this? Hmm? भोजन मंत्र क्या होता है? हम्म भगवत गीता का भोजन मंत्र है? भगवत गीता का भोजन मंत्र बोलो यार, तुम लोग एमएससी स्टूडेंट हो, कमाल कर रहे हो। हाँ? अहम वैश्वानरो भूत्वा प्राणिनाम देहमाश्रितः प्राण अपान समायुक्तः पचामि अन्नम चतुर्विधम। I am the Vaishwanara Agni residing in all the bodies of all the jivas. By balancing the upward and downward moving prana, I am the samana which is cooking the food. Prana apan samayuktaha pachami annam chaturvidham. I, pachami not means digestion, pachami means cooking. I cook it again. 4 kinds of food. What are 4 kinds of food he is talking about? And licked. Bhaksham. Hmm? Then Choshyam, Lehyam, and Bhojyam. Swallow. Chew कर सकते हैं, swallow कर सकते हैं, lick कर सकते हैं, suck कर सकते हैं. These are only 4 ways you can eat food. So food can also be classified in the way you can eat them. That is why it is called as Annam Chaturvidham. Can there be any food which can be eaten in any other way? Unless you are taking enema. There is no other way from the mouth that you can eat. Correct? बराबर? देखो यार, कृष्ण भगवान बोल रहे हैं, प्राण अपान अहम वैश्वानरो अग्नि। कभी आपने प्राणा को इस वे में सोचा कि जब तक अपर प्राण और लोअर प्राण बैलेंस नहीं होता है तब तक उसका डाइजेशन ठीक नहीं हो सकता। और जठर अग्नि जब तक बराबर नहीं है, इट मीन्स यू आर क्रिएटिंग ए स्पेस फॉर ऑल द डिसीजेस टू कम। सो मेनली द बैलेंस प्राणा इज द की टू हेल्थ। नाउ you have to tell me, among the Pancha Mahabhutas, which prana is connected to fire? Samana. Hmm? Which prana is connected to water plus earth? Why apana? See, if you drop water, water will go down. If you drop a stone, it will go down. If you drop both together, it will go down. Hmm? Where is water in our body? Stored in a tank. Bladder. Bladder से यूरिन कहाँ जाता है? नीचे जाता है, ऊपर जाता है क्या? कहाँ जाता है? नीचे जाता है। वेयर इज अर्थ स्टोर्ड इन आवर बॉडी? इन अ टैंक। रेक्टम, पुरीश। हम्म वो किधर जाता है? नीचे जाता है। बोथ अर्थ एंड वाटर आर गोइंग डाउन। फीसेस एंड यूरिन, हु इज टेकिंग देम डाउन? अपान। और कहाँ है अर्थ? अर्थ वेयर यू कैन sow a seed, the seed can grow and become a fruit. Where is that? Uterus. Uterus is अर्थ। वो कहाँ है? वो भी अपान की जगह पे। मेंस्ट्रुएशन नीचे जाता है कि ऊपर जाता है? नीचे जाता है। पार्चुरेशन, गिविंग बर्थ टू बेबी, उसके लिए अपाना चाहिए। रेगुलर मेंसेस के लिए अपाना चाहिए। इजैकुलेशन के लिए अपाना चाहिए। सीमेन, टेस्टिस, दे आर ऑल अर्थ वाटर एलिमेंट। देखो, अपान की जगह पे अर्थ और वाटर को कितना अच्छे से रखा है भगवान ने। नीचे वाले को नीचे रखा। मान लो ये सब यहाँ पे होता, फिर यहाँ से सब नीचे जाता। नीचे वाले को नीचे रखा। अर्थ, वाटर गोइंग डाउन is apan. Then which is the prana that goes exactly opposite to gravity? Which element is udan connected to? Udan, according to you, is connected with air and space. How many of you agree? Raise your hand. Only air, not space. Any one of you who doesn't agree with this, that udana is connected to air plus space? Raise your hand. अभी कॉमन सेंस लगाओ, ठीक है? If there is air in this hall, will it go down or up, or it will remain where it is? It will expand everywhere, correct? If this air has to only go up, आपको उसको बलून में हवा को सिर्फ ऊपर भेजना है, तो क्या करोगे? हीट। बिना हीट के कुछ ऊपर जाता है क्या? Without heat, can anything go up? Only up? It will go everywhere. Everywhere goes Vyana. So only Vyana is connected to air and space. But Udana has fire and air. Otherwise, how it will go up? Udana only goes up, no? Vomiting, belching, coughing, reverse peristalsis, ये सब उदाना का काम। तो उसमें फायर के बिना कैसे ऊपर जा रहा है वो? Samana has only fire. That's why it is at one space, one place. But Udana travels, इसलिए it has air plus fire. Vyana has only air because it expands in all the direction. वो नीचे भी जा सकता है, ऊपर जा सकता है, वो सर्कुलेट करता है, 3D है वो, पेरीफेरी में घूमता रहता है. It is like air going in all the direction. समझ में आया? So when you get burning in your body, or ever you have felt a burning sensation naturally, where do you feel it? ये पेट में और चेस्ट बर्निंग होता, क्योंकि यहाँ पे ही फायर है और फायर प्लस एयर, बराबर. यूरिन करते वक्त बर्निंग हो रहा है, उसका मतलब क्या हो गया? समानात नीचे चला गया, थोड़ा उसका जगह से डिस्प्लेस हो गया. सो What does it mean? It means your pitta, your fire is increased so much that now it is traveling to Vyana. हर प्राण अपनी जगह पे है तो healthy है. If it leaves its place and starts spreading at other places, it creates problem. Hmm? Why will prana leave its place and go to other place when its flow in its own place is blocked? I have constipation. My apana doesn't go down. Immediately, I don't feel hungry because my samana is dampened. You want to make the person feel hungry, you have to give him enema. बच्चे को भूख नहीं लगती तो हम क्या बोलते हैं बच्चे को? खा रे. खाना नहीं बोलना है, उसको बोलना है, क्या बोलना है? मोशन कर रहे, लैट्रिन. खा रहे नहीं बोलना है, हगरे बोलना. तो अपाना का फ्लो आप खोलोगे तो वो सामान अपने आप फायर पकड़ेगा. अगर अपाना क्रोनिकली ब्लॉक रहेगा तो जो अर्थ एलिमेंट है वो अर्थ एलिमेंट एबनॉर्मली बढ़ने लगेगा, तो उसके यूट्रस में फाइब्रॉइड हो जाएगा, उसको पॉलीसिस्टिक ओवरी हो जाएगा, उसको वाटर के और अर्थ के फॉलिकल्स बन जाएंगे ओवरी में. रेक्टल कैंसर भी हो सकता है उसको. प्रोस्टेट एनलार्ज हो जाएगा उसका. अर्थ एलिमेंट, वाटर एलिमेंट इंक्रीजिंग because its flow is not possible. See, air and space are basically everywhere. Without air, there is no movement. But air takes earth and fire in apana. Kapha pingu, pangu, pitta pingu. Pangu, mala dhatavah. Vayu is the one which takes everything. But fundamentally, जैसे कि रेगिस्तान में क्या होता है? रेगिस्तान में सैंड का ऐसे टीला बन जाता है, becomes a small hill kind of a thing with sand. Then when the wind comes forcefully, the whole hill is gone. It is shifted somewhere else. So basically prana is vayu, but that prana is moving other elements in different areas of the body. You understand? So this is the yogic understanding of prana. Similarly, when the apana is blocked, samana cannot function. Or there is another mechanism through which apana can be blocked. When the overall prana follows the law of conservation of energy, it cannot be created nor be destroyed, but it can be transformed or channelized from one form to another. Okay. So if in one area of the body prana is flowing excessively, then naturally there will be depletion of prana in another part of the body. So if I am in a state of intense anxiety or fear, what is happening to my prana? एंग्जाइटी और फियर में कौन सा प्राणा बढ़ता है? Which prana? I am very anxious, very fearful. What will happen? Which prana will increase? I am asking. Scientifically बता दो. What happens to autonomic nervous system when you are in anxiety? Sympathetic overactivation. When sympathetic overactivity is there, where does the blood flow go? From where? So your all waste product removal, digestion, all those processes stop. So अपान से प्राण निकाल लेगा वो. एकदम डर लग रहा है तो अच्छे से मोशन होगा क्या? यूरिन जो भी आ रहा होगा वो सांप को देख के वो बंद हो जाएगा. बराबर. विल यू फील लाइक मंचिंग फूड एट दैट टाइम? हंगर चला जाएगा. So samana also it is sucked from apana also, from samana also. It goes towards udana and mukha prana and also vyana. क्योंकि मसल में पावर चाहिए भागने के लिए, फाइट और फ्लाइट के लिए. So blood flow gets diverted from the GI tract to the muscle and the brain and the heart, lungs. This is natural shift from parasympathetic to sympathetic. Pranic language में it is a shift from apana and samana to udana, mukha prana and vyana. Make sense? Hmm? Sometimes some people doesn't they feel like passing. See these are when there are irregularities in the apana flow. Then in pulse, there is an urge to urinate, urge to defecate, but when they go, it doesn't come. It is like irritable. They become irritable because they are not able to flow down. So urge comes, but it doesn't smoothly flow, or they are not satisfied with that. Understand? So naturally, because some natural movement in the body which is going to take place, you are not able to bring that flow. So its natural tendency, and because of the state of anxiety, there is a struggle. In that you get those sensations. So when sympathetic activation takes place, blood flow gets diverted from the GI tract, urogenital tract towards your brain, muscle, chest, heart and lungs. It means that apana is withdrawn, samana is withdrawn, and the blood goes towards mukha prana, udana and vyana. This is a pranic imbalance. Correct? So it tells us one thing. Wherever blood flows, before blood, prana flows. Wherever blood doesn't flow, before blood, prana stops flowing. To understand prana flowing as blood flowing in grossly when you want to understand. Or electrical current or those aspects also you can correlate it with prana flow. Prana is subtler than electrical current, subtle than blood. But before these flow, prana flows. Now, I'm in a constant state of anxiety, fear, chronic stress. It will become a habit for my prana to always have more of mukha prana, less of apana, samana. I will develop chronic constipation, indigestion, irritable bowel. And also, if prana keeps moving excessively into some areas for a long time, it develops, which is a law in nature, when something moves again and again, again and again into a particular direction, it by default settles like that. So the set point is shifted. And if it becomes really chronic, then prana may start getting locked up into that area. So then after many years of this chronic anxiety, tension, people may start experiencing migraine headaches. Now the prana is getting locked up into the head region and it is moving excessively to the head on one side. The whole area becomes very sensitive. You cannot hear any sound, cannot see any light, because it will further increase prana in your face. And you cannot tolerate any further increase in prana because it is already excessively in this region. Yeah, will always, in the Panchakosha, nothing escapes. Modern science doesn't have Panchakosha, so they go up to Annamaya, up to genetic, and then they say idiopathic. We have prana, we have Manomaya, so we can explain everything. There is nothing like idiopathy. We are very clear from Manomaya Kosha, there is imbalance in thinking, which is leading to imbalance in prana, which becomes chronic. Prana gets locked up, it becomes very sensitive. Prana is life. Huh? Quality of life is to be sensitive. Whichever part of your body has developed hypersensitivity, it has excess prana. Too much sensitivity is also a problem. Whichever part of your body has developed less sensitivity, it has become numb, it has less prana. So, in fact, all human diseases can be divided into two, whether they are a manifestation of hypersensitivity or whether they are a manifestation of what? Undersensitivity. As soon as the food enters into my rectum, I get an urge to defecate. Irritable bowel. Even if there is stool, I don't get an urge to defecate. Constipation. So, excess of prana in that area makes the area sensitive. If the area is sensitive, you will have pain in that area. You will have other sensations coming in that area. If the area is insensitive, there will be no pain, but its functionality will be lost. So if there is lower motor neuron lesion, the limb is getting flaccid, paralyzed, prana is not flowing. Whereas if there is, what you can say, uh, redness, inflammation, pain, all the signs of inflammation, dolor, calor, pallor, they are all markers of that area becoming more sensitive. It means prana is moving excessively there. See, prana can increase in the initial stages, it can be mild. Later it becomes moderate, more and more prana flows, and when it becomes severe, prana may start getting locked up. And basically, prana is connected to thought. First thought, then prana, and after prana, pancha mahabhutas. So, अब आपका your apana prana is not moving down. Prana is moving up only. Correct? So slowly, slowly, over a period of time, the apana functions will start getting lesser and lesser. And these areas become more and more sensitive. Depending on these 7 chakras are like 7 knobs. You can regulate. The chakra can be moved in the clockwise direction to allow more flow of prana through that chakra. It can be moved in anti-clockwise direction to allow less flow of prana through that chakra. So which is the chakra regulating apana prana? Up, down. Mooladhara and Swadhisthana. Mooladhara, Swadhisthana are two regulatory switches for Apana flow. What is regulating it up or down? चक्रा के फ्लो को बढ़ाना और कम करना कौन कर रहा है? How can you voluntarily upregulate Swadhisthana and Mooladhara? You can. How? What will you do? Huh? He says there are asanas to increase activation. To do that, I'm not talking about yoga. Naturally, what are the ways in which there is upregulation of the lower two chakras? Naturally, what are the things that person can do or happens that leads to that increase of the lower two chakras? One is walk. You simply walk slowly, you feel like, okay, the constipation is getting relieved. Why walking increases apana flow? Because in walking you touch the ground. The sensitive prana moves downward. Other all parts are stable, only legs are moving. So the downward prana slowly gets activated by walk. People feel, no, that you feel better. Or if you drink hot water, then go for a walk. Your constipation get relieved. So there also the water goes down. Huh? And heat has a property of removing the blocks. So that is one thing we do. What else? What is the relationship of thinking and lower two chakras? Which kind of thoughts can upregulate or downregulate the lower two chakras? Manomaya kosha और प्राणमय कोशा का link we tried to understand. Anxiety में बढ़ेगा?
Sir, if the person is a cognitive type personality where too much task oriented, then there will be like down regulation.
उसका दिमाग ज्यादा थिंकिंग, इंटेंस थिंकिंग कर रहा है, तो शी इज टेलिंग इट विल डाउन रेगुलेट. ही विल यूज मोर हायर चक्रास, आज्ञा चक्रा, these chakras for intense thinking. So prana moves more in the upper chakra, so up regulate the ajna chakra. So other chakra will get down regulated, especially these two lower, the more intense is working. That is what she's saying.
And is doing something which is
Where are you going here? Come fast.
the person expose a dancer for using the body a lot, then there is some regulation. So the thoughts which are more creative and makes use of the body will upregulate the lower chakra.
So that first one I agree. Second one a little complicated, not that straightforward. It is not coming. Huh?
The craving thoughts and desireful thoughts.
Craving?
Thoughts and desireful thoughts.
Okay. If I close my eyes and imagine myself in a erotic kind of a situation, or watch a porn video, what will happen? Genitals blood flow increases. Erection, ejaculation, सब अपाना फ्लो से होता है ना. Sensual thoughts, they are activating my lower chakra, no? So there is relationship of thought with chakra. What happens? What kind of thoughts can upregulate or downregulate the Manipur chakra? Huh? Huh? Very good. Smell of food, thinking of food. सी मास्लोज हायरार्की में भी हम देखते हैं कि जो बेसिक जो चक्रास है वो सब उसका बेसिक सर्वाइवल से है. फूड, सेक्स, प्रोक्रिएशन. देखो बराबर लोअर चक्रा में चला गया. प्रोबेबली दिस इज आफ्टर बेसिक सर्वाइवल नीड्स आर डन. मुझे खाने को ही नहीं मिल रहा है, बेसिक नीड्स ही पूरे नहीं हो रहे, तो मैं क्या करूंगा? बट आफ्टर दैट comes the need for belongingness. What happens when you are emotionally attached to someone, and then because of some conflict you couldn't see that person or didn't speak to that person for a long time, but you kept missing that person. झगड़ा हो गया, प्यार था बहुत, झगड़ा हो गया, फिर बात नहीं किया दोनों, 1 साल हो गया, एक दूसरे का चेहरा भी नहीं देख. ठीक है? Suddenly that person comes in front of you. What happens? Where do you feel? अनाहत चक्र ऐसा 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 विचारा करता है. Only there you feel the sensation. You don't feel like defecating at that time. हायर चक्रा में यहाँ पे होता है, कुछ कुछ होता है. इस कुछ कुछ होता है इज अनाहता ओनली, नो. देखो, हायर नीड, those emotional thoughts increases, prana flow into anahata. If those emotions are suppressed, never expressed, anahata under functions. Or if the emotions are excessively accumulating in that area and it is not getting balance, it becomes over functioning, hypersensitive. If this area becomes hypersensitive, because there is so much emotional energy which is accumulating here, which is not getting channelized, what will happen? Hypersensitivity in this area is अस्थमा. इतना सा उसको विंड एक्सरसाइज से कॉफ करने लगता है. अस्थमा इज ए इमोशनल प्रॉब्लम. Emotion can affect Vishuddhi also, especially when the emotions are related to your creativity, in a way that you are not able to express what you want to do or talk out for yourself, or your creativity getting stifled, because after emotion comes creation. It is higher value. So to be able to speak out for oneself, to be able to express what one wants to do or create in life. So if that creativity is stifled, hypothyroidism, hyperthyroidism, chakra, vishuddhi, up, down. फिर intellect, too much of intellect, no emotion, only brain, no heart. फिर वो migraine headaches or those aspects. Or it is not as straightforward. Probably, the upper chakras, anahata, may be connected to head. It may be moving upward. Like in anger, emotion generates here but moves up because fire goes up. Anger always hits up. So people who suppress anger also get migraine headache, or when they are angry, they get headache. What I basically want to convey to you is that we do not understand it in its complete complexity, but grossly we can understand that in Manomaya Kosha, there are patterns of thoughts. These thoughts have certain characteristics. And based on that, these thoughts have the power of upregulating and downregulating your chakras. And through those chakras, upregulating or downregulating the flow of prana. When thinking pattern becomes a set pattern, there is a set pattern of the flow of energy through your chakra. When that becomes set, then there is a set pattern through which your Pancha Mahabhuta in your body starts aligning themselves. And that is what Ayurveda talks about. Now, Ayurveda में अब entry होता है. Yoga goes in much more depth. Manomaya, Pranamaya. Now, after Pranamaya comes the Pancha Mahabhuta, where then comes the movement of the air, water, earth, fire. फिर वो बोलते हैं कि dosha has left its place and gone to other place. सन्निपातज व्याधि, वातज व्याधि, पित्तज व्याधि, कफज व्याधि. अरे ये सारा जो व्याधि हो रहा है, वात पित्त कफ इधर उधर घूम रहा है, उसको कौन घुमा रहा है? वो बोलते हैं वात वायु घुमा रहा है. अरे वायु को कौन घुमा रहा है? प्राण घुमा रहा है. प्राण को कौन घुमा रहा है? विचार घुमा रहा है. विचार को कौन घुमा रहा है? अस्मिता घुमा रहा है. ये है इंटीग्रेटेड अप्रोच ऑफ योगा थेरेपी. You are able to see the patient, okay, before Vijnanamaya Kosha, there is Asmita, Vijnana, Manomaya, Chakra, Prana. Then comes, so Ayurvedic management is at the Annamaya Kosha level. Of course, it removes blockages and helps, but immediately after that comes your Prana management, Chakra management. And most importantly, the management of the Manomaya Kosha. How beautifully Yoga and Ayurveda integrate. Because their fundamental philosophy is Pancha Mahabhutas. Now here, naturopathy also comes very beautifully. It is even grosser than Ayurveda. It basically uses the 5 elements in its gross form. Ayurveda uses 5 elements in their subtle form. You will give hydrotherapy itself. You will make the person sit in water itself. Correct? Ayurveda understand that oil has water and earth together. You will give mud separately, oil separately, water separately. Ayurveda is more subtle. Ayurveda says that oil has mud and water together. So, grossest is naturopathy. Then comes Ayurveda. After that comes acupuncture. Subtler than Ayurveda. After that comes psychotherapy, homeopathy, even subtle. Subtler than acupuncture. Thought पे होता है homeopathy, पूरा thought पे होता है. Bach flower therapy. Yoga is everywhere. सारे कोश. Annamaya, Prana. The very basis of integration is yoga. This model of integration, there is place for every medicine. Modern medicine is Annamaya. Modern medicine, mein what do they do? You have dehydration. They give saline. तो वो क्या कर रहा है? In dehydration, what is happening? Your kapha is reduced, your water element has come down. They are giving water through saline. सॉल्ट होने से उसमें वाटर रिड्यूसिंग प्रॉपर्टी भी हो जाता है, और वाटर होने से कफा रिड्यूसिंग प्रॉपर्टी हो जाता है। तो वात कफ व्याधि होता है, तो उसको वो आईवी लाइन देके पंचमहाभूत को बैलेंस करता है। So therefore, the Department of Integrative Medicine has this vision: 5 basic elements in its gross form, naturopathy. In its subtle form, Ayurveda and modern medicine. Modern medicine also. Anti-inflammatory means pitta shamana, means fire को लो करने वाले मेडिसिन। शमना है, शोधना नहीं, सुपरफिशियली सप्रेस करेगा, सिम्टोमेटिक रिलीफ। Then subtler than that is prana. प्राणिक लेवल पे एक्यूपंक्चर आ जाता है, एक्यूप्रेशर आ जाता है, प्राणायाम आ जाता है। Then subtler than that is manomaya, where yogic psychotherapy, homeopathy, modern psychotherapy. And then when you want to go into Vijnana, then it is intense sadhana, spirituality, jnana yoga, those subtler aspects. So we as yoga therapists have this moral responsibility of never missing seeing the patient in all the 5 layers of existence. If you will not see, nobody will see. Everybody else is seeing only one aspect of the Panchakosha. They don't bother about others. Ayurveda will only look at the Panchamahabhutas, which goes up to Annamaya in its subtle form. Naturopathy will also look at Panchamahabhuta only. Acupuncture will only look at Pranamaya. And a psychotherapist will only look at Manomaya. सिर्फ बॉडी को देखते हैं, सिर्फ एनर्जी को देखते हैं, या सिर्फ माइंड को देखते हैं? माइंड, एनर्जी, बॉडी ऑल टुगेदर कैन यू सी, and can you bring a correction at all the levels? Diet is annamaya or prana. So that is what makes a yoga therapist the most holistic therapist among all. There is no one like a yoga therapist. The very fundamental base of integration. So you should be really proud and confident. You are able to look at the elephant as a whole. Somebody is looking at its tail, somebody is looking at its trunk, somebody is catching its legs. But you have the complete picture of the elephant. The whole art of yoga therapy is able to see the complete elephant. दिमाग में बैठा लो, how is the अस्मिता, सात्विक राजसिक तामसिक? What kind of predominant emotions are there? Lobha, moha, krodha. Which yamas are broken? Which chakra is overactive, which is underactive? Which prana is flowing excessively, which is flowing less? Overall, what is the prana reset time? Which swara is flowing more, which is flowing less? And then at the Panchamahabhuta level, which dosha in the body, kapha, pitta, vata is going up or down? And then how much flexibility in the body, how much strength in the muscle, bones, ऐसा पूरा. This is known as yogic formulation of the case. You always come in reverse. Start from Asmita, come up to the flexibility of the body and the BMI. Not missing anything. Which vitamins are deficient, diet. Understood? So this is what I wanted to talk about. Yoga therapy. Fine? Yes. Avidya is very difficult to measure. They come after us.
Actually, most of them say that fear of death is what really gives them those chain of thoughts. So it also keeps them ability so strong.
No, in our tool we look at all the kleshas. Avidya, you have filled that? You have your scores? Everybody has done that? So we have avidya, asmita. So we note down in all our cases also. I'm not saying I give only importance to asmita. Asmita is the root from where all, raga, dvesha, abhinivesha are coming up. But as a yoga therapist, you should be able to look at it, look at their kleshas. This is all about diagnosis. Diagnosing is one aspect. Treating is a very different domain. That is a separate skill that we will see in the next class. Okay, so then let us quickly look at some Patanjali Yoga Sutra now.